5 on your health now. A sharp rise in cases of a dangerous disease called dengue fever, especially here in Massachusetts.
Yeah, here to answer your questions is Dr. Simone Wilds. Dr. Wilds, thank you so much for being with us this afternoon. Now, when we think about dengue fever, we usually think tropical area, not here in New England. So why are we seeing a surge here?
Yes, Jen, we are seeing increase in cases here. And first of all, let me just tell you that dengue fever is a viral infection that's transmitted to humans by bites from infected mosquitoes. Here in Massachusetts, I speculate that one of the reasons we're seeing such increase in cases is because people travel to areas where there's a lot of dengue, they return home, and then what happens is they get bitten by mosquitoes here, which hence transfer the disease to other individuals. Also, another possibility might be due to climate change. As the temperatures get warmer and more humid, then mosquitoes are more likely to breed in those conditions.
All right, let's take a look at a map here for our viewers, Dr. Wilds. You can see on this map, Massachusetts, New York, and Florida. They are the states in dark blue, so they have the most cases. 50 cases confirmed so far this year in Massachusetts, nearly 2,000 across the country, but just 10 years ago, fewer than 700 cases nationwide. So what can you tell us about the symptoms that folks should be on the lookout for?
Well, the most important thing, Ben, is that most individuals, when they have symptoms, there's usually very mild symptoms. And when I say mild, they could end up with very high fevers. A lot of times they have severe body aches and pain. But really interesting is that they get pain behind the eyes, which is usually like a signal for us in the healthcare field to know it's probably dengue. They get nausea and vomiting, and they get a rash. Most people, they get better within a week to 2 weeks. However, there's about 5% of individuals that get dengue that end up with severe dengue. And that usually happens 24 to 48 hours after the fever has gone. And what happens is they get a lot of bleeding, their blood pressure runs low, and unfortunately, some people die. That is a medical emergency, and so those individuals, I recommend they go to the hospital immediately for attention.
Yeah, we need to be very vigilant. Now, something important you mentioned earlier is families travel abroad during the summer. Are there any precautions we should be taking when taking trips out of the country?
So, Jen, we're getting ready for the travel summer season that we all look forward to, and we're going to be engaging with various people. For example, some people might this year be thinking about going to Paris for the Olympics. You're going to see people from all across the world that come from regions where dengue is really very rampant in those places. So you're going to be spending time with them. And also, again, in a lot of areas, the weather is very hot and humid. And these conditions, again, allow for mosquitoes to thrive. So what I'm going to say to you, when you go, make sure you wear long sleeve, loose clothing. Very important, you wear insect repellent. Cover yourself as much as you can. Remember, we do not have a vaccine in place, so just make sure you take all the precautions you can so you can enjoy your summer.
All right, Dr. Wilds, thanks so much. Have a great weekend.
All right, thank you.